In this video, you will learn the procedural steps for performing female catheterisation, including the equipment required. This is an NHS Highland practice development skills video. This video has been made to be utilised in conjunction with the practice development skills training courses and can be used as a reusable learning unit to refresh your knowledge and skills. Course attendance and competency assessment must be completed before utilising the skill, and staff should make themselves familiar with the relevant NHS Highland skills policy, which can be found in the policies library on the NHS intranet site. Before approaching the patient, perform hand hygiene. Introduce yourself to the patient and explain the procedure, including risks and benefits. Gain verbal consent and check allergy status. Identify and check the following: the patient's clinical need for catheterisation, the size of catheter required for clinical need, when the catheter was inserted, and how much water is in the balloon. Equipment required: a dressing trolley, a sterile procedure or catheter pack, 2 packs of sterile gloves, appropriate size and length catheter, 0.9% normal saline or sterile water, appropriate attachment for catheter bag, a disposal bag, a drainage system or catheter valve, and sterile lubricating gel. Perform hand hygiene. Clean the trolley using a neutral detergent wipe and then wipe down with 70% alcohol impregnated wipes. Place all the equipment required on the bottom shelf of the trolley and take the trolley to the patient. Ensure patient privacy. Check patient's identity and allergy status immediately prior to the procedure. Ensure the patient is in an appropriate position and dignity is maintained if removal of any clothing obstructing access is required. Perform hand hygiene. Put on plastic apron. Slide the catheterisation pack onto the top shelf of the trolley. Then, using an aseptic technique, open the pack and other equipment required and pour the 0.9% sodium chloride into the galley pot, using an assistant if possible. Prepare the patient by getting an assistant to remove the towel and place the sterile sheet over the patient and a disposable pad underneath the patient. Perform hand hygiene. Put on sterile gloves. Separate the labia minora so that the urethral meatus is seen. Clean around the urethral orifice with 0.9% sodium chloride using single downward strokes. Apply 6 ml of single-use sterile lubricant, which contains a local anaesthetic around the urethral orifice, for example Instilogel or Optilube. Take off gloves, gel hands and apply new sterile gloves. Attach the sterile drainage system to the catheter. Using one hand to separate the labia minora, introduce the tip of the catheter into the urethral orifice. Advance the catheter until 5 to 6 centimetres has been inserted. If there is no urine draining and the practitioner is confident in the placement within the urethra, remove the catheter slightly. If still no urine drains, then remove the catheter completely and start the procedure again with a new catheter. If urine is present, advance the catheter a further 2 to 3 centimetres. Once the catheter is in place and urine is flowing, gently insert water into the balloon according to the manufacturer's instructions. Withdraw the catheter slightly, ensuring not to pull tightly, and secure with a device, for example a Clinifix. Attach the sterile drainage system to an appropriate catheter hanging gripper or catheter stand and place below the level of the bladder. Observe for urine and document volume. Help the patient put on their clothes and ensure they are comfortable. Dispose of equipment as per policy. Perform hand hygiene. Observe the patient for any adverse reactions and document and manage any complications. Clearly and legibly document the date, time, size, length and type of catheter and insert catheter label. Include reasons for catheterisation, amount of water in the balloon, volume of urine drained and any complications. Ensure insertion sticker and invasive device bundle are completed. Please ensure that appropriate PPE is worn when carrying out all clinical skills, including aprons. Aprons have not been worn during the making of these skills videos to reduce noise interference.